New numbers show overdose deaths have surged during the pandemic in this country. CDC data shows more than 87,000 Americans died from drug overdoses between September of 2019 and September of 2020. That is a 29% increase from the year before, and it's the highest number of deaths reported since the opioid epidemic began back in the 1990s. For more on what is behind these disturbing numbers, we're joined now by Dr. Paul Christo, Director of the Multidisciplinary Pain Fellowship Program at Johns Hopkins University. Dr. Christo, really good to have you on here today to break down what is going on. What is it, do you think, about the pandemic that has led to this sharp rise in overdose deaths?
Well, no question about it. I mean, the pandemic has led to a lot of economic hardships. We've seen a lot of people under, and at the same time, we've seen a lot of people emotionally stressed due to the pandemic. I mean, they've seen their friends and family members die, and this is extremely, extremely hard to cope with. So as a result, we've seen more and more people turn to substance abuse as a coping mechanism.
Is this also about a lack of access to treatment? Because we did have obviously a lot of drug treatment facilities and those sorts of places that had to shut down because of the virus.
That's certainly true. I mean, the good news is that we've seen more and more of these substance abuse treatment centers and access to treatment increase as a consequence of the pandemic. One of the positive consequences of this actually has been a greater use and availability of telemental health services. And this has really been a boon for those who need them because you have greater access now to psychiatrists, to physicians, counselors, and therapists online in a way that didn't exist before. And this is critical because it can help people get access to the substance abuse treatment, the therapies, the support groups that are so critical in terms of preventing relapse and also treating drug abuse.
All right, let's try to break down the numbers. If you can help us a little bit in terms of who is dying from these drug overdoses in this country. Are we talking about people in big cities? Are we talking about people in rural areas? Is it a combination of both?
It is a combination of both. We've seen a lot of people die in rural areas of the country, actually. And the other thing that we've seen happen here over time is we've seen a lot of these deaths that are related to overdoses. Well, certainly it's increased in 2020. It was about over 70,000 in 2019, and that is a result of the pandemic. But about half of those overdose deaths in 2019 were due to synthetic opioids. These are drugs like fentanyl, carfentanil. The other half were due to stimulants like methamphetamine and cocaine. And this is something new that wasn't expected, but we're seeing to a greater extent. And actually, what's even scarier is that we're seeing both adults and adolescents die from a combination now of opioid and stimulant like methamphetamine.
Wow. All right, so let's talk about solutions and hopefully trying to reverse this trend that we're seeing in this country. How much do you think the vaccine rollout, the reopening of our society is going to help curb this problem?
I think that will. I think the other thing that we've seen that is helpful is that the Centers for Disease Control is conducting studies on this problem, on overdose deaths, to better combat it and come up with better strategies to address it. We've also seen the rollout of naloxone. So for those who have opioid addiction, no question about it, naloxone is the opioid reversal agent that can save lives. The other name for that is Narcan. I think that needs to be more widely available, though, throughout the country, especially in rural areas. It doesn't have to be prescribed by a physician. It can be, but in certain states, the pharmacists can go ahead and dispense it without a prescription. And telehealth, telemental health services are on the rise to assist people in need. And also medication-assisted treatments. These are also called agonist therapies. These are drugs like methadone, buprenorphine, Suboxone. Again, the data is clear. These drugs help prevent relapse. They reduce craving and are really important in preventing people from relapsing and overdosing.
Yeah, sounds like they can make a huge difference. All right, really appreciate your time and coming on to talk about this really troubling issue that we're seeing unfold here, a crisis underneath another crisis in this country. Dr. Paul Christo, director of the Multidisciplinary Pain Fellowship Program at Johns Hopkins University. Greatly appreciate your time. Thank you.
My pleasure. Thank you.